All right, let's talk about hormone replacement therapy and how it works and if it's right for you. I'm Dr. Betty Murray. I'm a clinical nutritionist and certified functional medicine practitioner with the Institute for Functional Medicine. I'm also the Bone Coach lab expert, and I'm a 20-year veteran in the women's health industry. I've actually am the CEO and founder of Living Well Dallas, a long-term functional medicine practice in North Texas, and we've helped tens of thousands of women transition through the perimenopause and menopause and beyond season, and this is what we do. I also am the CEO and founder of Minerva, part of the Minerva Project, which is a telemedicine company that treats women all across the United States with bioidentical hormone replacement for perimenopause, menopause, and beyond. We also treat thyroid. Now, what I'm going to talk about today is why hormonal health is so important, number one, to your bones. And then we're also going to dispel some common myths you may have been told over the last 2 decades about hormone replacement therapy. Now, in the first training, I talked about the value of hormones in helping the body both rebuild and get rid of old bone, but especially building bone. And our sex hormone, particularly estrogen, is the primary driver of bone building. And so when women go through menopause, we lose this valuable hormone along with progesterone and testosterone that also have their own effects on bone turnover. And what that does is accelerate bone loss for women. And the honest truth is all women are losing bone in perimenopause and menopause unless they're actively taking hormone replacement or a bone drug, or also if they're doing the right diet, lifestyle, nutrition, exercise program. But what I'm here to tell you today is that alone may not be enough to really drive bone building and to really create strong bones, particularly if there's a significant amount of bone loss. Now, what we're going to talk about today is what you want to consider about hormones, the common myths, and also whether hormone replacement is right for you. So let's talk about number one. Everybody's heard this myth, and the myth is that hormone replacement therapy, particularly estrogen, increases the risk of reproductive cancers like breast cancer and cardiovascular disease. So let's talk about where that really came from and why that's inaccurate and what the research really says. So, I'm a PhD. This is my area of research. So, my job is to go through that and help you understand it. So, hormone replacement therapy was standard of care for women in the United States and most westernized countries, so Europe, Canada, and up until 2002, it was the most commonly prescribed medication, even over statin medications. Anywhere from 40 to 70% of the menopausal population was put on hormone replacement as standard of care. Now, all of the studies through the 50s, 60s, 70s, 80s, and 90s all showed hormone replacement to be protective to women. And it was one study called the Women's Health Initiative. And it was a study that was started in the 90s to look at the risk of cardiovascular disease and stroke, so heart attack and stroke, and to see if hormone replacement therapy reduced that risk. So let me explain where they went wrong. And so, number one, in this study, in order for us to assess risk of dying, in a perfect world, we would have a group of people that had high risk, and then we'd have healthy individuals that we could compare to. Well, in this particular study, they excluded healthy populations. So, what does that really mean? The average age of the woman in the study was almost 62 years old, so significantly 10 years past menopause. Number two, the majority, three-quarters, were overweight, obese, previous smoker, had high blood pressure, high cholesterol, and other risks. So they already had advancing cardiovascular disease. Now, why did they do this? These studies are millions of dollars to actually run. They cannot run these for decades. So the intention was to pick a population that were already at risk, already exhibiting signs, and then hope that they could see whether hormone replacement was protective or not. Now, the study went on, and there was three groups. There was a group that were given no hormones at all. during the study, there was a group that was giving just Premarin. Premarin is a now generic drug, but it was one of the first oral estrogens that came out, and that is derived from horse mare urine, so pregnant horses, and it contains 13 estrogens. So if you watched my other class, we only make 3, so those other estrogens are subject to how the liver sort of processes them. The other group was given Premarin and another synthetic fake progestin called medroxyprogesterone. So it is synthetic. It is not bioidentical to the progesterone that we make. It has associated clot and heart attack and inflammatory risk in all people. And as a matter of fact, birth control pills that contain that have class action lawsuits for causing stroke and heart attack in young women. So anyway, that group took both of those medications. Flash forward a couple years, the group that was taking the synthetic medroxyprogesterone and Premarin, known as PremPro, showed an increased risk of stroke. So they halted the study at that time. Now, the group that were taking nothing did not. The group that were taking estrogen also did not. Now, as they were preparing the study, a small group, a subcommittee within the committee, released information to the media. And one of the statistics that they put forth was that there was a 25% increased risk of breast cancer in the group that took PremPro, that synthetic progestin and estrogen. Now, what was the real data on this? Because it was a change of 25%, but it was not statistically significant. And here's what the real data said. So all women, if you are in this age group, have a 4 in 1,000 chance to get breast cancer. That's just the stats, regardless of what you do. Now, in this particular group taking PremPro, it went from 4 in 1,000 to 5 in 1,000, which is actually not statistically meaningful and actually would be considered something to chance. Now, because they were looking for a reason to get rid of what they said the runaway train of women getting hormone replacement therapy, because that was their bias going into this, they wrote up, while the study was in peer review, which means peers are looking at it to look at the science and make sure that it's strong and test and see if it's correct, they actually released it to the media, and the media went wild. And overnight, women were taken off of hormones. Overnight, doctors were told that it was dangerous. Overnight, they added a black box warning saying that estrogen caused heart attack and stroke and the risk for breast cancer. They failed to point out that the women that were on Premarin alone showed a 23% reduced risk in their own study for breast cancer. Right? I want you to sit with that for a moment, because that means that they were pushing their bias. And unfortunately, it kept getting perpetuated into the media. So the reality is, since that time, on 8-year, 18-year, and 22-year follow-up, this last year, they actually reanalyzed the data and showed everything that they had originally kind of pushed out to the media was inaccurate. But yet we're still paying the price for it. So basically 2 decades, an entire generation of women have been robbed of the opportunity of hormone replacement because estrogen replacement therapy was approved for the treatment of osteopenia and osteoporosis in 1988 as the first-line treatment before any anti-reabsorptives or any other medications. But when this happened, it was taken kind of off of the standard of care. So, number one, it does not cause reproductive cancers. None of the studies that were done for decades prior to the Women's Health Initiative showed that. And all of the studies that have been done since that show that it's not true. And there's some very large studies that we talk about in the Bone Coach programs that actually look at reduced risk when women are on hormone replacement therapy. And when you get to bioidentical hormone replacement therapy, which is different than the oral Premarin and different than the synthetic progestins, it's bioidentical, meaning the hormone key that you make, what they give you in a prescriptive form is the exact same key. Those forms given topically, like estrogen topically in a patch or a cream or an oil, testosterone given topically in a cream or an oil, progesterone taken orally, absolutely have no increased risk of cardiovascular disease and actually are protective in all causes of dying. Every single way of dying, hormone replacement therapy reduces your risk. Dementia reduces it by 23 to 34%, depending on your study. Most of the studies show like a 32 to 34% reduced risk of dementia and Alzheimer's. Breast cancer, 16%, colorectal cancer, 11%, ovarian cancer, 32%. So we've been told a lie. Hormone replacement therapy with bioidentical hormones at therapeutic levels that help protect your brain, your heart, your bones do not increase your risk for breast cancer, ovarian cancer, or any other cancers. And when done appropriately, they may actually protect you from all causes of dying. Ladies, if you're noticing more fine lines and wrinkles, it's not just about aging, it's about the loss of estrogen. And that affects our skin structure, making it drier, thinner, less firm. But here's the great news. I've created Biased Mastery Cream to help. This luxurious bioidentical estrogen cream supports your natural hydration and elasticity. It's packed with nourishing oils like olive, jojoba, aloe, and coconut, so it feels amazing and helps soften those lines and bring back that healthy glow. I've been using it, and let me tell you, my skin has never looked or felt better. It's smoother, more radiant, and those little cracks and creases are way less noticeable. If you're ready to give your skin some extra love, check out Biased Mastery on the Metabolic Blueprint website. And that's metabolicblueprint.com/Biased Mastery. That's BIEST Mastery, MASTERY. And your face will thank you. Now, myth number 2. Hormone replacement is not beneficial or risky after X number of years. Sometimes people hear 7 years, sometimes people hear 10 years, that it's dangerous for women in their 60s and 70s. Now, like I said, we've been doing hormone replacement for 20 years in my clinic. 20 years. I have women in their mid 80s that were put on in their mid 60s, still playing tennis, still running around and having a great life. So, what's the truth here? So, hormone replacement therapy has the most beneficial window when it is actually given in the perimenopause and menopause transition. So, think of it this way. If I have a maximal amount of opportunity for the best case scenario for my body to operate in its best possible way, giving hormone replacement as I go through perimenopause, or at least in that early transition time, is the best time. However, there was a gigantic study that was done and published in 2024 looking at 10 million women's records and looking at all causes of dying between 2006 to 2023. This was a Medicare age study, so all the women were well over 65. And they looked at all causes of dying: heart attack, stroke, dementia, cancers, and they looked at them in 3 different categories: women who never did hormones, women who did hormones for a short period of time and stopped, and then women who did hormones and stayed on them. And in the group where they did hormones and stayed on them, it was the first time that they could separate the oral Premarin, Prempro from bioidentical topical forms in very large amounts. And what they found in all causes of dying, doesn't matter which one, hormone replacement therapy reduce that risk in all causes. And particularly if you did bioidentical topical forms of estrogen, testosterone, and oral forms of progesterone, we actually saw no increased risk of cardiovascular disease and or stroke. And so that window of opportunity has now broadened. When we do bioidentical forms with topical forms, we don't have to worry about the cardiovascular risk that comes from taking estrogens orally. It's when you take them orally and they go into the liver first and get processed, the byproducts of those oral estrogens can increase stroke risk in a much older individual, but the topical forms do not do that. So that window is, yes, the best we can get, particularly with brain remodeling, is when we start it earlier. But that doesn't mean a woman who might be 65 or 70 doesn't have the opportunity to look at hormone replacement for themselves and have a conversation with a professional that understands how to treat menopause. Like I said, we routinely and have had women for decades taking hormones and very, very healthy. Now, what are some possible contraindications to taking hormone replacement therapy? Why wouldn't you want hormone replacement therapy? In most cases, and I would say in all cases, you deserve the right to talk with a practitioner about your individual health and whether that's a good choice for you. Now, we've recognized that it doesn't cause cancer and that you can still take it even if you're 5 or 10 years past the window. So the next thing would be who would maybe not be the best choice? If you have a long-standing family history of estrogen and hormone sensitive cancers, that may be a conversation to forego. But even if you look at some of the studies actually show hormone replacement therapy to be protective in certain forms of even breast cancer. I strongly recommend a book called Estrogen Matters by Dr. Avram Blooming and Carol Tavris. They actually go through all of the research. So, strong family history of estrogen sensitive cancers. BRCA carriers, the BRCA mutation that accounts for 8% of cancers. That mutation can potentially increase risk. However, it has nothing to do with your estrogen. Estrogen and BRCA do not interact at all. What BRCA does is it helps clean up spelling errors in your DNA. So when you have a mutation there, a BRCA mutation, it can't clean up spelling errors. So your body produces more errors when it replicates cells, which makes the DNA damaged and you have a potential to create tumors. It has nothing to do with your estrogen. So just being a BRCA carrier doesn't necessarily mean you are not a candidate for hormone replacement. In many cases, we have people on progesterone and testosterone, and we might forego estrogen. Stroke, deep vein thrombosis, and heart attack risk. So if you've had DVTs or stroke or heart attack, the topical forms have now shown to be protective. And in that study that I quoted, the 10 million woman study, they actually said it in their abstract that all risk for stroke and heart attack is completely mitigated by topical forms. So even if there is that history, because estrogens protect the blood vessels and heart and brain when you have it on board. So there's no real contraindications. What we want to make sure is when you get hormone replacement, you get the right kind. It should be bioidentical. It should be topical, meaning it goes on your skin. So it's either a cream, a patch, or an oil. And then there are also pellets that get embedded in your muscle tissue and fat. I'm not as fond of those. And then there's also oral progesterone only. That helps a lot with sleep. And so the rule is estrogen topically, testosterone topically, progesterone orally in most cases to help with sleep and relaxation. Those are the best ways to replace. Now, let's recap what the main thing is and the focus of hormone replacement therapy on bone health. When we restore your hormones to physiological levels, which is actually very low compared to what you did every month when you ovulated and you got ready for your period, we're actually replacing about 10% of what you made at any given month. It's very small amounts, but what it does do is protect the brain, the heart, the bones. It stimulates that building side of the bone, slows down the deconstruction side. It helps build vasculature, so it helps build blood supply to the brain. It helps the heart and blood vessels and arteries stay young and flexible. And it also has an extraordinary effect on the brain. So, hormone replacement therapy helps build bone, but has so many other benefits for women. Not not even also to mention that it has a big metabolic effect on the weight gain and other things that we often see, particularly around the middle for women. So, hormone replacement therapy should be the first line therapy in osteopenia and osteoporosis. And again, it was approved in 1988 for the treatment of osteoporosis. Now, if you'd like to get help with my company's Balancing Your Hormone and help you with optimal health, you can take these two simple steps, right? So, step number one is click the link for the OsteoIQ below, but this helps you order your foundational labs. These are the labs that we would need to help you treat your hormones. And we look at a full picture. We don't just look at hormones, we're taking a full snapshot of your health. Now, the second link will take you to a link to actually work with my team. And here we help you understand number one, how hormones may help you in your own individual quest for health, both your bone health, brain health, heart health, and overall health and longevity. And we can also help you understand what the appropriate treatment should be for you long term. Because if that 10 million woman study showed us one thing, it was hormone replacement therapy is protective against all causes of dying, and that the minute you stop it, the minute you lose that support. And that the idea is we restore it to physiological levels so you get the protection you need and you continue it long term. I hope you found this valuable. Don't forget to click the link below to get your OsteoIQ testing, and then click the link below that to speak to a member of my telemedicine team.